Hi, I'm Genesis Salvador and today I'm going to tell you a little about percutaneous repair or medical treatment for secondary mitral regurgitation. Introduction. In patients who have chronic heart failure with reduced left ventricular ejection fraction, severe secondary mitral valve regurgitation is associated with a poor prognosis. Whether percutaneous mitral valve repair improves clinical outcomes in this patient population is unknown.
It's important to remember when we're talking about mitral regurgitation that when the blood is going backwards into the left atrium, there are no other valves between the left atrium and the pulmonary bed. So the pressure that is in the left ventricle essentially becomes reflected back into the pulmonary bed. Normally the pulmonary bed pressures are very low compared to the body pressures. So the normal body pressure, which is 120/80, which is what we normally refer to, the arm pressure, the lung pressures will be normally 20/10, 20/15. So if the mitral regurgitation is severe and there's much leakage, that will clearly impact the severity of the pressures and elevate the pressures. And that's, in essence, is what begins to cause people to have shortness of breath, is that their pressures are too high in their lungs.
Definition. When your heart pumps blood, it's supposed to follow along a specific path in one direction, but sometimes it goes the wrong way. Mitral valve regurgitation is the name for one of those times when your blood isn't going where it should. With this condition, some of it leaks, but where instead of flowing out to the rest of your body. Causes. The most common reason this happens is because the mitral valve is damaged. This can be either from birth or because of a heart attack, which can weaken the tissues around it. You may hear a doctor say a valve is prolapsed or if it is seen close up the way it should. Application in medicine. In patients with secondary mitral regurgitation, previously referred to as a functional mitral regurgitation, the mitral valve leaflets and short are structurally normal, and mitral regurgitation results from alteration in left ventricular geometry and function. Severe secondary mitral regurgitation is a predictor of poor clinical outcomes in patients with heart failure and reduced left ventricular ejection fraction. Treatment. Medication can actually fix a valve problem, but they can target other things that make regurgitation worse. Drugs called diuretics can lessen fluid buildups. Blood thinner can help prevent clots. You can take something if you have high blood pressure, which may regurgitation worse, and percutaneous MV repair. Percutaneous EMB repair is a minimal invasive approach to treatment of certain patients with symptomatic chronic significant AR. Currently, the only U.S. Food and Drugs Administration approved device for percutaneous EMB repair in primary and secondary NR is the mitral clip. Pros and cons. Pros. Minimally invasive surgical approach is a slightly shorter recovery time and mortality reduction. Cons. The primary efficacy outcome was a compulsory of death from any cause or unplanned hospitalization for heart failure and 12 months after randomization. Sacrifice on the right international thoracic artery, and main obstacles is the existence of the functioning tin of the heart.
Mitral regurgitation is the most common valvular heart disease in which the mitral valve doesn't close properly and blood leaks backwards into the left atrium. The result is excessively high left atrial pressure that may lead to edema and reduced ventricular function. Mitral valve regurgitation occurs in about 2% of the population. In the U.S. alone, there are over 2.8 million people suffering from moderate to significant mitral regurgitation requiring medical intervention. To date, the best long-term clinical results for mitral valve repair involve implanting a D-shaped annuloplasty ring in open heart surgery. This highly invasive procedure comes with increased risk, potential complications, and longer recovery time. ValCare is proud to introduce Amend, a proprietary D-ring implant designed for mitral valve repair and replacement in a minimally invasive procedure. During the transapical procedure, the catheter is inserted through the apex, advancing along the left ventricle and crossing the mitral valve in a linear configuration. Once the catheter is in place, the ring is deployed, changing its geometry to form a D-shaped ring configuration. The ring rotates 90 degrees and aligns itself with the mitral valve plane. The ring closes into a D shape. The stabilizing tool is then deployed, enabling full control over the ring and enforcing intimate contact between the ring and the tissue when required. Attachment of the ring is done using a series of 12 anchors in 4 different zones that are independently deployed. The posterior zones of the ring are anchored first. Once anchored, the posterior side is pulled toward the anterior annulus, reducing the anterior-posterior dimension by 15 to 25%. The anterior section is now anchored to the anterior annulus, fixing the ring to the annulus. This results in reduction or elimination of the mitral valve regurgitation and improved leaflet coaptation. The unique technology enables Amend to serve not only as a mitral valve repair system, but also as a secure platform for total mitral valve replacement, where it serves as a landing zone for valve prosthesis. ValCare's innovative patented technology has several distinct advantages. A new technique that serves as a versatile platform for mitral valve repair and replacement. A short and simple procedure. Effectively achieves anterior-posterior reduction without significantly changing other dimensions of the native annulus. One ring fits both minimally invasive and fully percutaneous approaches. ValCare, revolutionizing mitral valve treatment.
Issue applied in Ecuador. According to the data collected by the National Institute of Ecuador, in 2014, a total of 4,430 deaths were reported due to ischemic heart disease. Conclusion. Among patients with severe secondary mitral regurgitation, the rate of death or planned hospitalization for heart failure at 1 year death not differ significantly between patients who underwent percutaneous mitral valve repair in addition to receiving medical therapy and those who received medical therapy alone.
Looking back on it, I didn't recognize the symptoms. I thought I was out of shape. I was getting a little older. I was 48 at the time. I just had a very difficult time running. I had a difficult time exercising. I had a difficult time getting through the day.
He was definitely run down. We would go play golf and it wouldn't even be warm out or anything, and he would just be like sweating and tired.
And I just thought that maybe I was getting older and I was out of shape. But actually, I had alcohol.
One of the cords on the valve had broken away, and the valve was not sealing properly. I was having severe regurgitation back into the lungs, so my heart was working harder to pump the blood because it's just regurgitating back into the lungs.
He did the research, and we met with a couple doctors at different institutions and ended up at Montefiore with Dr. Mitral.
What he needed to really decide is, A, was the surgeon going to repair his valve, fix it? And B, what was the rapport he had with the surgeon and the team? Did he feel comfortable? Did his family feel comfortable? He was concerned about us and concerned about our well-being. He made us feel at ease. His problem, in the hands of many programs around the nation, would have been a simple valve replacement. In our hands, we feel very strongly that repairing valves is the best thing for a patient. It's their native tissue, it lasts long, it's very durable, and if we can perform a repair on the valve, we think it's certainly the very, very best thing for a patient. I went into the hospital the day of surgery. Obviously, I was very nervous.
I think we felt, we did all we could, and at this point, we were going in, we felt comfortable. Dr. Mitral made us feel very comfortable.
There's really nothing too simple in the area of heart surgery. It requires a tremendous amount of evaluation before the operation, and then you have to perform at the highest level when you're in the operating room with the heart stopped, the clock ticking, and you have to decide where to cut, where to nip, where to sew, and knowing that the longer it takes you to do that, the more risky it is for the patient, and the less likely they'll have a good outcome.
It's unbelievable. He can just do so much more. It's important to me because we go out there, it's just the two of us, and we talk and laugh and play. It's something we both really enjoy.
I can do anything. I'm strong again. It increased the quality of my life immensely. It's more than just the surgery. It's the entire care that a patient receives that makes their experience a positive one. Definitely was the best choice I made. I was happy with Doc Mitral, the staff, the nurses, everyone there was fantastic. They treated me like I was a member of their family.